Good afternoon, everyone, and welcome to today's press conference for Friday, the 8th of January. Firstly, I'd like to wish you all a happy new year, and I hope that you had as good a Christmas as possible under the circumstances, and welcome back to what has been probably quite a traumatic week for the county as well as for the country in terms of COVID-19 and the response and the subsequent lockdown. So today, on our panel, we have Lucy Whiteman, of course, our Director of Public Health. We have Eileen Doyle from Kettering General. We have Superintendent Elliot Foskett from the police, and Toby Sanders, who's the Chief Executive of NHS Northamptonshire Clinical Commissioning Group. Bit of a mouthful, but it's always worth So what we're going to do is we're going to come to them to talk about their individual areas, and then we'll open up to the questions that we have had pre-submitted. We have a number of other people also on the call that can answer some specific questions. So we'll come to them as and when we get to that. So I'm going to come to Lucy Whiteman first, and she's going to run through the figures for the latest surveillance report, such as they are. Thank you, Lucy.
Thank you, Councillor Morris, and good afternoon, everybody, and welcome again. It's quite strange, really, to think it's only been 3 weeks since we had one of these press conferences before Christmas, and just really quite how much has changed in that short period of time. So, obviously, as usual, we have produced our weekly surveillance report, and as I said, it's a real step change since before Christmas. As you can see, there's a number of key headlines here in this report. So clearly, we're now in a national lockdown. Those restrictions are in place across the whole of England until further government review. And at this point in time, there is no definitive date for that. Obviously, it gets continuously monitored, but from a point of view of the actual lockdown finishing, I think people are quite well aware that it looks like we're in this for a reasonable period of time because of the significant changes. And that is primarily driven by the second point, that there is now a mutant variant strain of COVID-19 that is prevalent across the country. A number of areas have already had that confirmed through typing, but just to be clear, there is limited laboratory capacity at a national level to do that. So we're using a lot of genotyping as a sort of a proxy measure for where we think that mutant variant strain is, but also you can just see from the patterns, the epidemiological patterns of the rate of increase in cases where that virus is prevalent. And unfortunately, Northamptonshire is one of those areas that is following that national trend, which has been very much driven by London and the South East. So, we are saying with a really quite a high level of confidence that that strain is now in Northamptonshire, started very much in the early part of the festive break period in South Northampton, Daventry, but obviously we've seen considerable changes in places like Corbett as well in the last week. So really quite rife and in most of our boroughs and districts at this point in time. And that's caused the government to urge those clinically extremely vulnerable adults and children to shield again. So those that were obviously taking really extended precautions in the first lockdown to be doing so again because of the high rate of infectivity of this new strain. And that locally has meant that we've recorded a startlingly high number of cases in the week up to the 3rd of January. That was 4,307 cases across the county. That in turn, because of the sheer numbers, is really ramping up pressure in our acute and primary care and community care services. And this now is not just a conversation around will we have beds for our COVID positive patients, but this is now significantly impacting the system's ability and potential ability in the next couple of weeks, because this new variant is still very much in a growth phase of us to be able to meet the normal urgent and emergency care demands that we would see. So, road traffic accident, attendance and treatment, lumps, bumps and potential cancer investigations. These services are now under significant threat. So whether people feel that they personally are at threat from COVID and COVID-related hospitalisation or not, they certainly are still at risk of those needing those wider services. And over the coming weeks, if things doesn't significantly change, we could be in a position where we're unable to fulfil those demands as well. So quite a stark set of headlines there. If we have a look at the detail, if we go to the first slide with the data, please, Cheryl. So again, you can just see that epidemiological curve. You know, I was, and partners in the panel here today, expressing significant concern at the spike that we saw pre the lockdown in November, that short period of lockdown. And we were talking about, you know, just under 2,000 cases. We're now more than double that. It's a startling change. And, you know, unfortunately, as I said, the R rate locally is considered to be well above 1. As it is across the country, and therefore for every case they are infecting more than one person in turn. So as I said, we're still very much in a growth phase of this virus, and we are likely to see our case numbers increase significantly further until the impact of lockdown really starts to take effect. If we go on to the next slide, please. So in that week up to the 3rd of January, you can see just a field of red increasing arrows from a point of view of the crude number of cases. Northampton, you know, 1,600 cases just in that one area alone. That, as I said, was a concerning figure for the whole county only a matter of 4 to 6 weeks ago. So it really does paint a very stark picture. All areas affected, all areas seeing an increase in the crude count of cases. If we have a look at the next slide, please. So illustrated beautifully in the graph, obviously you can see that the England and the county trend are following a very, very similar pattern. And that was my point earlier about if we had any doubt and, you know, we're looking for typing, which, you know, is unfortunately very short supply, you just need to look at the national trend and how we are echoing it locally. That demonstrates the fact that those areas that have got the virus, that the variant virus that we're aware of, London, South East, etc., that is driving this significant increase in the national trend, we're following that trend. The virus, the mutant virus is here and it is prevalent across all of our boroughs and districts. You can see that startling increase in Corbett in the last 2 weeks, particularly in the last 7 days. But equally, you can see a very sharp increase in all of our boroughs and districts. So had we had this conversation 2 weeks ago over the Christmas break, you would have seen that stark increase and that really rapid increase in case numbers and rates in Northampton, South Northampton, Daventry as well. So we are unfortunately seeing that pattern echoed across different boroughs and districts as this virus makes its way up the country. If we go on to the next slide. So it is still younger people, working age people that are driving this trend. You can see obviously from the bold text here that most positive tests in males, I should say, were 30 to 39-year-olds and in females 20 to 29-year-olds. But clearly there's, you know, a significant distribution across all age groups here. If we go on to the next slide. And this is a real challenge. We know that this variant, although it spreads much more rapidly between people, it isn't causing more people to die. The rate of mortality is not higher. It seems to kill the same proportion of people as the first variant did. And equally, we're seeing similar rates of hospital admission as we did with the previous variant. The challenge here is that just the sheer number of people being infected means that the number of people who are at risk and require hospitalization, and sadly, therefore, the number of people who also don't make it out of the, you know, either hospitalization or a period of illness from COVID is also increasing. So although, as I said, a similar hospitalization and mortality rate as the first variant, the sheer numbers here are causing our trends, as you can see, to significantly increase. If we go on to the next slide. So if we compare areas again, so making them, you know, the same proportion, the same size of population, I should say, you can see the variability here across the county. So obviously the Northamptonshire rate here at 502, that is higher than the East Midlands average rate, although lower than the England overall rate. But you can see here boroughs and districts that are similar to the county rate, and also that Northampton continues to be statistically significantly higher in both compared to Northamptonshire and the England rate. So a real challenge. And you can see, as I said, the pattern that actually it's more our southern areas, and obviously now Corbett, as it's making its sort of way round the areas that became tier 4 before us and tier 3 before us, you can see the numbers increasing as it spreads through the county upwards. If we go on to the next slide. So this is, a very, very stark graph as well. The number of beds occupied by confirmed COVID positive patients has grown exponentially. We obviously saw a significant push to discharge people just prior to Christmas. Obviously lots of people being at home, being able to facilitate that, take on caring responsibility and help the system, which was brilliant news. But that was just as the new variant was obviously starting to touch the edges of Northamptonshire. Since we've seen that it's much more prevalent, and we've seen that local case rate in echoing the England case rate, we've equally seen the number of admissions surge. Obviously this graph shows the data up to the 5th of January, and at that point we had 342 COVID positive patients in our beds, and Eileen will be giving a more up-to-date figure later, I'm sure. But a stark and significant increase. Again, that's putting pressure on, as I said, our bed base, but also our staff are not immune to this virus, and because it is so highly contagious, we are seeing more staff affected, we are seeing more staff having to self-isolate. So our ability to be able to provide those ongoing services is very much at risk at this point in time. If we move on. So the next 3 pages, as they always do, just give you that pattern of distribution of the virus. So the last 28 days, you can see the number of cases and the case rates by area, and on that last of these snap slides, it just shows you that case rate change again. So you can see obviously the difference in the case rate change and how quickly it's taking over in certain areas. Following that over time gives you a really interesting idea about how the epidemiology and the virus itself is sort of spreading, as I said, northwards through our county, skirting round the edge as we speak. If we go on to the next slide. Now, interestingly, obviously, a lot of businesses and schools, etc., shut for the Christmas period, or certainly had far fewer staff in, and that gave us a very welcome break from having outbreaks. But we have seen, particularly in the last week, so since particularly the 4th as well, the number of outbreaks go back up as people have returned to their essential work where they can't work from home, but also obviously where people did at some point mix over Christmas, we started to see the effect of that in outbreaks as well. At the 4th of January, we had 24 active outbreaks, but you can see obviously that the number of outbreaks, although lower, was still quite complex. They've got quite a few cases associated with each of the outbreaks. These aren't outbreaks typically with 1 or 2 people associated with them now. We're seeing much greater numbers of people associated with each outbreak. And again, it's a very clear reflection of the fact that this is so much more transmissible, much more easily passed between people, and therefore sadly, as we get notified of outbreaks, they tend to be much larger than we've seen historically, and that's a national trend. So again, we're just having to make sure that we're working with our enforcement officers, both the police, but also within these settings, our environmental health officers, health and safety executive, etc., to make sure that obviously all of the businesses, schools, health and social care settings maintain their COVID secure status, that all employees, while they're travelling backwards and forwards to work, but also at work, are maintaining their COVID secure actions, and that the general public, which is still where we see most transmission happen, around 80% of it is still happening within and between households. So making sure that people in the community are adhering to the hands, face and space mantra. If you don't get close enough to somebody to catch this virus, you are protecting yourself and others if you happen to have it and don't have symptoms. So, those basic 3 steps are still our most successful steps in being able to beat this. If we move on. One of the good news stories, obviously alongside COVID vaccination, is that the flu vaccination programme has been very successful and continues to be in Northamptonshire. And again, this is about helping people protect themselves against all of the normal winter illnesses and ailments, but also again helping to protect some of our capacity in primary community and acute care. So, we've seen really, really good increase in uptake this year compared to last year in flu vaccination in the core groups. So that's really good news. And again, I'd implore people to continue to get their flu vaccination as they get called up. The flu season goes all the way through till March. And in fact, I only had mine recently as well. So please, if you get that call for your flu vaccination, please do go. You will need it alongside your COVID vaccination, and the schedules around those can be worked out. It will not stop you having your COVID vaccination. We will just provide an appropriate gap between those. So please don't be put off. And if we move on to the last slide. So just to make sure people are aware, obviously the legislation around enforcement and the rules has changed. We meet regularly between the police, environmental health officers, my data teams, my public health experts, Public Health England, and a variety of partners to make sure that we're supporting everyone and every setting to be as COVID secure as possible. And this is so much more important with this new strain than it was before. We have got to maintain high standards, both ourselves and take personal responsibility for protecting those around us, but also in our business settings for those businesses that continue to operate over this period of time. So please, if you have any questions, any queries, you can contact your local borough or district council and get support, but also the county council. So if you have any concerns, any queries, want to make sure that obviously you continue to operate safely, please do let us know and we'll be doing everything we can to support you.
Thank you very much, Lucy, as always, for that run through of the figures, all very worrying in a sense, it has to be said. And today, of course, as we know, the Mayor of London declared an emergency in London, but I don't think we can say that that emergency is very far away for everyone else in the country. In fact, you could almost argue that we're already all in that state of emergency. So it's a question of holding our nose for as long as possible and sticking to these rules as long as possible in order to get the vaccinations rolled out that can get us out of this current situation. So there is light at the end of the tunnel, but it is quite a grim state that we're in, really, if I'm totally honest. So let's move on to Eileen Doyle, who's from Kettering General Hospital, and she can give us an update on the position within the hospitals. Eileen, thank you for joining us as always. I know how busy you are, as particularly in this current time, so we really do appreciate your attendance, Eileen.
Thanks, Councillor Morris, and hello everybody, good afternoon. So I'm here on behalf of Northampton General and Kettering General this afternoon to give you an update really on where we're at and how we're doing. Lucy's obviously gone through a number of the statistical points that I would ordinarily cover, and I'll try and just give you a picture of what it's like at the moment and what our planning going forward looks like. So we have 344 COVID positive patients between the two organisations in our inpatient beds today, and that's actually down from the beginning of the week. So we're hoping that that continues, but I think at this point in time, we're expecting that to rise further. So it's definitely busier than it was in the COVID one. So that's about a third of our beds really, and COVID one was about a quarter. So that gives you kind of an indication of where we're at with that. And obviously coupling COVID, we've got winter. And if I sat here any year, I'd say, gosh, this is the worst week of the hospital calendar year, because it's right after Christmas and it's really when things start to ramp up over a winter period. So we've got COVID and we've got winter. And on top of that, of course, we are trying to keep as much work going as possible for those patients that need other urgent care. So our cancer patients, those that need urgent intervention, because they don't stop. And one of the things that we learned from COVID-1 was putting those patients off actually is much more dangerous than potentially than COVID might be. So we've tried really hard in both hospitals to keep that going for as long as possible. Having said that, certainly since Christmas and coming into Christmas, we plan to take some of the routine work down, because we would ordinarily do that as part of winter planning in order to cope with whatever surge came along. It just happens to be COVID this time. And so we have, in the last week, 2 weeks, and going forward for the next 2 weeks, looked at taking down more routine work that's booked, because for two reasons. One, we're pretty full. So we're running at 95, 96% occupancy across both organisations. And what we don't want to do is cancel people at the last minute. So we have to plan that we are not at our peak yet, according to our modelling. And so therefore, We have to make sure that we have enough emergency capacity to be able to deal with those patients who come in unexpectedly, but also trying to maintain those patients that need really urgent intervention. And you'll have heard this in the press, that particularly for those who perhaps think, gosh, I've got away this far, I'm not going to get COVID, I'll be fine, I'll have the vaccine in a little while. You may not get COVID, but you may spin off the road, especially with the current weather. Your mum, dad, nan might have a stroke, might have a heart attack. All of these dreadful things happen, and we have to maintain enough capacity in every acute hospital throughout the country to be able to deal with those life-threatening emergencies. And so even if you're a non-believer of COVID, well, I'm not sure how anybody can be, but there are those out there that think it doesn't belong to me. It's really, really important that everybody, we all have a responsibility to try and help you hear it all the time, but try and help the NHS maintain that capacity for those that really need it. So COVID is busy. In terms of our intensive care capacity, between the two organisations, we've got 29 level 3 beds open today, of which 18 of those patients are COVID positive. So that again is an increase, and we've seen a bigger increase actually at the Kettering end. We were rather hoping, and before Christmas you'll have heard both Debbie and I talk about fairly steady numbers, but we've definitely seen an increase, and it is not necessarily everybody old anymore. And not that it ever was, but I think there was a perception that it's very much if you get into those kind of dire straits, then you must be of a particular age. We are definitely seeing younger patients being very seriously affected by COVID. Now, that does make us technically full. However, both hospitals have surge plans in place, so that if we needed to double that capacity, we could double it. And so therefore, there is room at the inn. We have those plans because they've been in place for a very long time. So if we needed to go to twice that number, we could do it. It wouldn't be easy, but we could do it. So just to reassure everybody. In terms of staff absence, obviously staff across both organisations have had the ability to have access to lateral flow testing, which has helped certainly, because it's meant that with staff doing regular tests, that you can pick up sooner rather than later if you think that you might have COVID on board, and then go and have a PCR test to confirm or deny that. We have 256 staff out of about 10,000, putting it into context, off with COVID-related symptoms today, or positive COVID. And that is, so that's about 2.5% against a 6.5% overall sickness or absence rate. So it's not the predominant reason why people are off sick, but it is making it very genuinely difficult, because of course the isolation period is also factors into that. And obviously, a family member, if you're a primary contact, you have to adhere to the rules. And so if I was to say anything is challenge, it's staffing and trying to keep everybody, really keep places safe, because that's our primary concern, is that the care that we provide, we may have to provide it in a different way than we used to, but our absolute number one issue is to maintain safety. Now going forward, and as I've said, I don't think we're at our peak yet. I'd love to say we are, and we're very grateful for lockdown actually, because it's sort of, if you think about it, the peak, the rise that we're seeing now probably correlates directly to that Christmas Day period. If that had been 5 days, actually, it sort of doesn't really bear thinking about. So whatever we did or didn't think about the reduction to 1 day, I'm sort of grateful for it, because I think that goodness knows where we would be. But we have to think that we are going to have more COVID patients than we currently have got. So we are modelling to make sure that we are able to go up by another. If we have another 150 patients, for example, between the two organisations, that really makes us very, very full of COVID. And so therefore we have to look, and working with partners, both in social services, in primary care, in our community trust colleagues, to work out how we might provide care differently, because not everybody can be in acute bed, perhaps in the way that they might be at other times of the year without COVID. And so therefore we're working really hard to work out how we use the community hospitals differently, how we support care home placements differently, how we support care homes and their residents differently, to try and really make sure that everybody is getting care, even if it is in a different care setting to perhaps what might ordinarily happen. Because I think there is a reality that's coming our way very quickly, and let's hope it's not let's hope we go below the peak that we've modelled for. But I think if we fail to plan, we plan to fail. So there's a lot of work going on at the moment to work out how we do things differently. I've talked about we've stood some work down. We are using our independent sector, so our private facilities locally, to try and push through as much work as we can to make sure that we're keeping that steady flow of patients that need their operations and interventions going, so that it doesn't come to a complete stop. One thing to say is children's services and our paediatric wards very often this time of year would be full, and they're currently not. So I suppose if there is a small blessing, it doesn't seem to be affecting children, and long may that continue. I think some of the questions that have been coming through is, how does it feel? It feels, everybody's tired. People are tired. This has been going on for a really, really long time now. But I think certainly from both, if Debbie was here, she'd say the same for NGH. I think all colleagues across health and social services are really digging deep to keep going. And although everybody is absolutely exhausted and very much looking forward to the summer and hope that we can have holidays somewhere to, whilst we're all vaccinated, to get over this, there's no doubt that we are having to make sure there's enough support in for staff who are pretty tired. This has been going on a long, long time. I think that that's really all I really wanted to say, other than obviously, you know, this applies to all of us. Nobody likes being locked down. I don't like being locked down. But it is what it is. There is light at the end of the tunnel. It's not forever, but it's really important we stick to the rules, because if we don't, the consequences could be really dire. So on that cheery note, I should probably stop there. Thank you.
Thank you, Eileen, as always, and for all the hard work that you, as I've said already, that you are doing in both our acutes. It's really, really impressive. You're absolutely right. It's our personal responsibility as individuals to prevent this from spreading and to try and protect our NHS. So we must do that and stop thinking about it. It's not going to be me. It's not going to happen to me. It's not about that. It's about so much more than that. Thank you, Eileen. And of course, I'm going to bring in Toby Sanders now for the light at the end of the tunnel moment with the vaccination programme update, because this is what we're all holding onto now, I think, in lockdown, is the thought that this could well be over within a relatively short period of time, and we must behave accordingly in order for that to happen. So I'm going to come over to Toby now. Toby, thank you for joining us again. I know you're incredibly hard working at the moment, and really appreciate your attendance here today.
Thank you, Councillor Morris, and it's nice to be able to come on today and talk actually about the fact that there is light at the end of the tunnel and there is a way through all of this, and it is the vaccine programme and the vaccine rollout. And Lucy and Eileen have very well described the reality of the current pressures that all of our health and care staff are working under across the county, but this is the way through that. So I'm delighted today to be able to share an update, I think for the first time actually, on these Friday briefing sessions on where we currently are across the county, which I have to say is making an extremely strong start in terms of the vaccine rollout programme. So I do have some really positive news to share today in terms of the three delivery models, in terms of how we are delivering the vaccine programme locally. I'm going to share a little bit about some of the numbers in terms of where we're at, and also a bit about what happens next in terms of as we go forward over the next few weeks and months. So to start off with the vaccine rollout programme across Northamptonshire, the first thing to say, as with most of what has been talked about today, this really has and it is a massive multi-agency effort to pull this off. And we have huge contributions being made across health and local government sectors as part of the partnership that's delivering this. And I'm very much here as a spokesperson today on behalf of that partnership across a whole host of different organisations. As we're sat here having this conversation this afternoon, we have made a really strong start since we first started vaccinating the county on the 9th of December. As of today, we have passed the 25,000 point in terms of the number of people that we've been able to vaccinate across the county so far. And that is a significant number when I come on a bit later to put that into context, and just shows the speed at which we are stepping this up. And of that 25,000 or so people that we've been able to vaccinate so far, that's already taken us over halfway towards vaccinating with first dose at least all of our over 80 population across the county. So there's some really, really significant positive progress we're making here to finding our way through all of this. So a little bit then about how we are delivering the vaccine programme across the county. There are three different models that we're delivering vaccinations through. The first of those are what we call hospital hubs, and we have two of these hospital hub sites currently operational within the county. The first of them at Northampton General went live on the 9th of December. That was the first site within the county to deliver and put a vaccine into the arms of one of our elderly population. The second of those hospital sites at Kettering General has gone live in the last couple of weeks. So we currently have two hospital hubs within the county. Those hospital hubs started off focused very much on the over 80s that were within hospital, as well as health and care staff. Increasingly going forward, they'll focus on the health and care workforce. largely because the other different delivery models I'll touch on in a moment are really where the big numbers are going to come through in terms of the wider population and our local people. So those hospital hub sites are up and mobilised at the moment. The second of the big delivery models we have, and this is where some of the really big numbers come through, are what we call our local vaccination services. And there's kind of two elements to this. The first and the big numbers are the general practice run and delivered models. Our general practices across the county, the 70 or so GP services that we have in the county, come together in what we call primary care networks. These are groups of 3, 4, 5 practices working together. And that gives us 16 of those groupings across the county. As of today, we have all 16 of those GP groupings live and delivering vaccinations to our local population. And that includes through a combination of both the Pfizer vaccine, and we've also started this week taking delivery of the Oxford AstraZeneca vaccine into the county as well. So those 16 GP-led vaccination local services started on the 15th of December, and as of today we have full coverage across the whole of the county, which means that patients in the top 4 cohorts, and at the moment in the first 2 of those cohorts, that's the over 80s, residents in care homes and health and care workers, are being reached out to that are registered with all of our practices across the county. The second element of those local vaccination service models is a roving service that we've already started to establish and is really going to step up more going into next week. And this will enable us to reach out and be able to vaccinate residents and in some cases staff as well in care homes and also the housebound. So our community teams are going to be physically going out into those locations, particularly enabled by the developments of the Oxford AstraZeneca vaccine, which I'm sure we all know is much more mobile and easier logistically to move around the county. And then the third of the delivery models that we have, which we expect to come on stream over the next few weeks, is the larger vaccination centre. Many of you will have picked up this week that I think was on Wednesday. We saw the first of the 7 large centres going live across the country in places like the Excel Centre in London. In Northamptonshire, we are putting in place and finalising plans to be able to open and run our own vaccination centre within the county, which will provide significant additional capacity in addition to the hospital hubs and the local vaccination services. So in terms of those patients and the population who are being called and invited in for vaccination, this is still very much a route where we're asking people to wait to be called. You will be contacted when you get through those priority cohort groups. Just a reminder, the first priority in those 2 cohort groups, the over 80s, residential care residents, and then the health and care workforce. But we're also expecting to rapidly be able to get out to the 3rd and 4th priority cohorts in terms of the 70 to 74-year-olds and the 75 to 79-year-olds. Coming back a little bit briefly to some of those numbers to put this in context, I said at the start of my brief today that as a result of a huge push across all our agencies, we've managed to tip the 25,000 number in terms of number of people vaccinated. You all have heard the national pledge and commitment around the middle of February, and the goal there of being able to prioritise all of those first 4 priority cohorts. Here in Northamptonshire, that translates to about 135,000 people that we would need to vaccinate by the middle of February to be able to do that. We have the delivery models and we have the arrangements in place locally to be able to deliver this, provided we can get the vaccine in sufficient supply coming into the county to be able to respond to this. So we are ready. We have a programme that is mobilised. We have further capacity we intend to bring on stream. The last 2 messages, Councillor Morris, I just wanted to emphasise before closing this part of my session, is that firstly, please do wait to be contacted. You will be contacted once we get to that point through the priority cohorts. And secondly, we are aware, although not thankfully at the moment, particularly in Northamptonshire, that there have been some scams circulating through social media and through other routes, asking for people's details, particularly personal details or banking details. The NHS will not and never will ask you for that sort of information. So if any of the public have concerns about those sorts of scams, they are just that. We will contact you through official formal routes when we get to that point. And the very final thing, Chair, to reference today, of course, is that I'm sure most of us have also picked up the news nationally of the approval of the 3rd vaccine, the Moderna vaccine by the MHRA, which again is just further good news about the longer run in all of this. We're expecting that to be the other side of spring in terms of nationally when that potentially starts to become a route into this country. But certainly that is just a further example of the arrangements being put in place that will lead us to a better place, as Eileen was saying, hopefully as we head into the summer and the other side of spring. Thank you.
Thank you very much, Toby. Some really heartening news in there. And I think our response as a county has been second to none, as always, with these things. I know we're all slightly biased, but the facts speak for themselves. I think Northamptonshire has really come up to the mark and will and is probably ahead of some other counties in terms of the vaccination programme. So we'll see how we go with that. I'm sure there'll be some questions for you, Toby, in a minute. But I'm going to come now to Superintendent Elliot Foskett, who is helping to enforce these the lockdown rules, etc., and keeping us all safe during the lockdown. Elliot, good afternoon to you, sir.
Yeah, good afternoon. Thank you, Councillor Morrison. Thank you on behalf of Northamptonshire Police to our NHS colleagues. I think we've all seen the frankly harrowing pictures on the news, and I just want to put out from us to yourselves a big thank you, but also to our teachers, I have to say, to continue to provide the education to our kids, and especially personally for them to for keeping the school places open for critical workers, so that we can continue, ourselves and our NHS colleagues and emergency services, etc., and others, continue to offer the vital services for the rest of the community. So thank you. So on that note, it's vital that everybody, in my view, takes personal responsibility by staying at home, unless you've got a valid reason to not be there. And this is how you can do your bit. So I understand it's not an easy thing to do, but it is the right thing to do. And again, I know I've said this before, it's not about trying to work around the rules or thinking it'll be all right if I just, it won't be all right if I just stay at home if you should be at home. It's as simple as that. As I said, I understand it's not easy, but people do know the rules, and you don't even have to understand the intricacies of the law. All you need to know is that you should stay at home as much as possible and not mix with other people. It's as simple as that. The government website is really clear. It's got some very clear advice and good do's and don'ts. So go and have a look on the government website if you're in any doubt about whether what you're about to do is the right thing to do. We've seen, as a force, a big increase in the amount of calls and reports, online breach, a percentage of them. I've redirected even more of my officers to deal with COVID breaches, both proactive, high visibility patrols for both reassurance and deterrence as well, I should say, and response to the breaches as they occur as well. And I know people may be a little bit nervous about being stopped, especially if they've got a good reason for doing so. But the vast majority of the interactions we've had with people have been very positive, and no further action's been taken in most cases. But for those people who blatantly ignore the regulations, and a small minority of people who do it over and over, or who simply just don't care, you should expect to receive a fixed penalty notice if we talk to you. Unlike some forces, we're not simply targeting the most serious breaches, because we think we're beyond that now. The public out there do understand what is required of them in the majority of cases, and we therefore are enforcing against all breaches we find. But that aside, the vast majority really of people in Northamptonshire, in Northampton, Corbett, South Northants, Wellingborough, they continue to follow the rules because they know how important this is. Traffic flow on our roads, it may not look like it to most of you. I've heard anecdotal reports, but traffic flow on the roads is down by about 40%. Still short of what we saw in that initial lockdown, but then there are different rules at the moment. And that's really important, again, with those journeys, not undertaking unnecessary journeys because of the risk of collisions, especially in the weather that we've got at the moment, the poor weather, poor visibility. You'll put even more pressure on my colleagues, on our colleagues in the NHS and the fire service, fire and rescue service, and EMAS. Please don't make those journeys unless you have to. And so finally, as you'd expect from me, my message for those of you who think it's okay to break the law because for some reason you are some kind of exception or special case, you'll expect to get a £200 fine or more if you break the self-isolation rule. So the simple thing is, if you break the law, we'll be knocking at your door. And that's it from Northamptonshire Police.
Thank you very much, Elliot, as always. And I think as with the NHS and the hospitals, your work has been amazing during this period. And I know you've suffered some staff shortages as well because of COVID and various other things as well. So thank you very much. And I think, I've said it many times, this isn't a them and us. We're all them versus us versus them. We're all in this together, including the police, and you're here to keep us safe. So thank you very much for that, Elliot. I'm going to come to the questions now, if I may. So first up, I've got Laura Coffey. Laura, hi.
Hi, Councillor Morris.
Hi, I do feel your two questions have possibly been answered, but I'll give you a chance to perhaps ask another question if you wanted to, Laura. Thank you.
Yeah, thank you. I've got a couple of other ones, so I'll ask those instead. It kind of links in with my first question, so it is to Eileen Doyle. We've obviously heard today that the London Mayor has called a major incident. Surrey and Sussex called one on Thursday. I asked before Christmas kind of how close were the hospital trusts in Northamptonshire to a major incident? How far away are we now? And also a question to Councillor Tom Beattie. Can you just, I've seen your press release sent out this afternoon. Can you just expand on what you mean by non-essential manufacturing facilities? Can you give some specific examples for Corby?
Thank you, Laura, for those. I'll come to Eileen first and then to Tom, if that's okay. So we'll start with Eileen. Thank you.
Thank you. Thanks, Laura. So I think that both both hospitals actually did remarkably well over the Christmas period. An awful lot of planning went into it to make sure that both from a staffing and a bed availability perspective, we managed things well. I think things have really only got tighter in the last seven to 10 days. And so therefore, as I said earlier, we are planning we have to plan to what the modelling tells us our peak might be. So I don't think we are I don't think we're in London territory, but we would never say never. And the reason for all the planning and working with partners to make sure that we are able to provide care in the right setting or alternatively an alternative setting that's also safe is to make sure we don't get to that point. We don't want, I don't want corridors full of patients or that we get to our absolute max capacity and then wonder what we do next. We're trying to plan for the worst, so that if the worst happened, then we know how to deploy people. We are in the process as of this weekend of looking at staff and redeploying some staff to support clinical areas who are under particular pressure or have particular levels of sickness. So I don't think we're there, but we've always got one eye on it to make sure that we don't end up there. I think London is in a particularly, and the whole of the Southeast is in a particularly tricky situation, and we don't want to get there. But that's also down to we need things to not spiral out of control in terms of incidents. So let's hope the lockdown and the busyness that we're seeing now with our COVID load starts to level out soon, and then comes down the other side as people get vaccines on board and things get a little bit better for everybody. So we are not there.
Thank you, Eileen, for good clarification there, and a good question from Laura. I'll come to Councillor Tom Beattie, who's the leader of Corby Borough Council, just since you asked him that question. Tom.
Yeah, thank you, Ian, and thanks Laura for the question. What I've done is I've been contacted over the last few days by numbers of people in Corby, often people who are at work, who are reluctant to identify themselves, but who don't feel particularly safe. And the thing about Corby, I think, is that it's quite different from other parts of the county and its industrial makeup. There is a lot of people in Corby work in manufacturing industry. I think only a couple of years ago there was an Office for National Statistics survey which said something like more than 20% or up to a quarter of people in Corby worked in manufacturing, making things. And there's an awful lot of people who work in logistics. So the opportunity for people who work in those types of environments to work from home doesn't exist. They have to go in. And I think during the last lockdown, a lot of people were able not to go to work, but they were able to take advantage of the furlough scheme. I understand the rules this time around are different, and no one's doing anything out with the rules of the law. So I want to make that clear. But what I am calling upon the government to consider is whether the guidance and whether the statement that says that where people cannot work from home, they should continue to travel to their workplace. I think it needs to be reconsidered about whether that workplace is essential, whether that types of support that were previously offered to those sorts of workplaces could be offered again. we have seen rising incidences here in Corby. Lucy pointed that out in her original presentation at the beginning of this press conference. Whilst cases are rising all over the county, Corby has seen a particular spike recently. And I think the danger or the worry is that the industrial estates in Corby seem as busy as they were before the lockdown began. And that is causing concern. And I think that is potentially dangerous. And I just would like the government to think about how they might be able to support people in what you would call non-essential parts of the economy. And that's difficult, I understand, to identify. That's difficult to sort of define. But there are parts of there were industries and factories in the previous lockdown who were able to do that. And I think we maybe need to think about that again.
Thank you very much, Laura. Can I come back to you at the end if you have a subsequent question? I'm just very concerned about time here, Laura. I just want to whip through some of the other questions first. And if you wanted to come back at the end if we have time, would that be all right?
Yeah, of course, that's fine. Yeah, go ahead.
Laura, I do apologise. It's just we're getting quite tight on time. So I've got Alice Wilson next from Northampton Live. Hi, Alice. I do feel, and this isn't just to speed things up, but I do feel that your questions have largely been answered as well, Alice, but I don't want to not give you the opportunity to ask something. So it's over to you, Alice. Hi.
Hi, thanks, Councillor Morris. Yeah, thank you everyone for such thorough reports. I think all of the ones I did submit have been answered. But just very quickly, to Tony Sanders about the vaccines. Obviously, it was a really thorough description about what's going to be happening over the next few months, and it all sounds really positive. But you did mention that the Northamptonshire is going to expect sort of a major venue of a big vaccination centre. I appreciate it's probably really early in the plans, but are there any plans for where that might be and how long that might take to set up? Because I think after the army-led battlefront kind of speech that we were given by the Prime Minister, people are quite keen to know about that. And second of all, I'm not really sure who to direct this question to, because as far as I'm concerned, everyone on the panel is now a COVID hero. Everyone's working through this lockdown. But as you're all aware, last night was kind of the revival of the Clap for Heroes at 8 p.m. But I'm sorry to say it didn't really have a brilliant turnout, and quite a lot of our readers have sort of said it feels a bit tokenistic, and they'd rather see something more substantial be given to our COVID heroes, you know, like pay rises and, as I think Eileen Doyle said, you know, guaranteed time off at the end of all this. So I just wondered if any of our COVID heroes had any sort of feelings about the low turnout, but also what that might have meant for them.
Thank you, Alice. I'll come to Toby first, if I may, to just answer the question on the venue, which I suspect he probably won't be able to answer in any specific detail, but I'll come to him first. Toby.
Okay, thank you, Councillor Morris, and thank you, Alice, for the question. I will say a couple of things on this, but I'm not going to put a name against a location and a venue. What I will say, Alice, is we've been working on this locally across agencies since before Christmas. We do have a venue within the county that is physically pretty much good to go, and a workforce model and equipment within that facility. Its ability to open is dependent on the ability to get vaccine delivery in sufficient quantity into the county to enable us to do that, and also to complete the final mobilisation and sign-off checks with our national and regional colleagues in NHS England. So we are very far advanced and progressed with that. I look forward to the point on these calls in hopefully a couple of weeks' time when I am able to put a venue to that. But I can say that this isn't a plan for something that we're starting to work through. This is something that is kind of at 80% there in terms of being able to get to that point of going live with that. It's largely going to be vaccine delivery dependent in terms of our ability to do that. And that's something which we've been doing across health and local government partners. We've always had actually military input locally supporting some of our planning work, and that's been the case over most of the last 10 months. But this is a facility that will be primarily run and managed by local health and local authority partners. Thank you.
Toby. I think I'll come to Lucy Whiteman on the second bit of your question, and also Richard Auger, I think, wants to come in. So I'll come to Lucy first quickly, if that's okay, because we are tight on time. So apologies, Lucy.
Yeah, a really quick response to this. Absolutely understand why there may not have been as big a response as there were the first time. I think everybody is very tired of COVID at the moment, but the one thing that people could do is adhere to the rules. I think more than a pay rise, more than a holiday, more than anything else, if people could just do as they are asked to do, that the science dictates is the safest thing to do for themselves and for others, that's all we could ask for right now.
Absolutely agree with that. I'm going to bring in Richard Auger, but and we can clap as much as we like when this is over as well, and celebrate in amongst us, all of us, the whole across society. Richard, did you want to come in on that point?
Yeah, I think Lucy couldn't have put it better, really, and makes my comments seem very feeble. But she is absolutely right. Just to let I think the public know is that I have personally written to the government and asked them for some sort of national recognition. I know in the police service we received medals, officially minted medals from the Queen, and for all of our heroes. That may be an idea, but of course, extra money, how much, extra leave, how long, there's lots of things we can do. I think hopefully the government have something planned. I would love to see a national medal for all those that have been on the front line. I know not everybody would accept it, but I think a national recognition, a Queen's Medal for service during COVID would be a great way to reward our National Health Service and other care services heroes.
Thank you so much, Richard. I think we would all echo that and the comments that Lucy made as well. So thank you, Alice. I'm going to move on to Kate Cronin. Hi, Kate. I do feel that your questions have also been answered, but I'll give you the opportunity to ask a quick question if you wish to ask one. Kate.
Okay, thank you. Well, I've got two questions. I suppose one of my questions has been answered, but can I ask Lucy, please? We saw that graph at the beginning, and we saw the big sharp rise in Corbett all of a sudden, which has been doing quite well with its case rates. Can you tell me what specifically has happened in Corbett to result in that huge spike just around Christmas time? And have you made any sort of specific public health interventions? I know we've had a story today about a factory in Corbett, a logistics hub, where there's been a large number of cases who've been busing people in from London every week. Have you made any specific public health interventions there, or any of the other logistics places in Corbett? And secondly, I'd like to ask about schools as well. We've had so many teachers, parents, head teachers speaking to us about the high level of attendance in schools. We did a story yesterday about it. Are you concerned about that, Lucy? And any of the other panelists who want to speak about that as well? I personally feel that if you've got the schools half full, we've got all the teachers in, it's not really locked down for our schools, and we're putting our teachers and potentially some of the pupils who do need to be there, who might have underlying conditions, we're putting them at risk. So I'd just like to ask for your thoughts on that, please.
Thank you, Kate. I'm going to come actually first, I think, to Paul Andrews from our school cell to answer the school's question first, I think, and then we'll work backwards through your questions, if that's okay. So, Paul, are you there?
Yeah, I'm good. Good afternoon, everyone. Thank you, Councillor Morris. Kate, thanks for the question. I mean, there has been a lot of attention on this. I think it's been a very difficult week for schools and for parents and for children themselves. We've gone from the expectation of everyone to be in schools to all of a sudden for schools to be closed. And I think it's taken a degree of adaptability, both from schools and from parents and from children, to get to where we are today, where I think things are starting to settle down. Just coming to the nub of your question, I think there's been a misunderstanding of the government's intention regarding the closure of schools. Schools haven't been closed to help reduce, have been essentially closed to help reduce the overall number of contacts across society, you know, so right across the country, not because they were unsafe for children or staff. And yesterday, the DfE released guidance yesterday afternoon, and there are 2 points from that guidance that I think I'd want to bring to people's attention, to your readers' attention, to listeners' attention. And the first one of those is parents and carers who are critical workers should keep their children at home if they can. And the second point is there is no limit to the number of pupils or critical workers who may attend schools, and schools should not limit attendance of these groups. And I think the point I want to make about this is, as we've done throughout this pandemic in Northamptonshire, this is about us working collaboratively. It is about both parents adhering to that point that only send your children to school if you really have to, and it is about schools making those places available. If we all do that, if we all work collaboratively together, we'll get through this. I think schools have done a fantastic job this week. I'm immensely proud of the efforts of schools and head teachers and their staff. It's been a phenomenal effort, and it's really pleasing to know that my colleagues in the police and the health service recognise that. Hopefully that answers your question, Kate.
Thank you.
Yeah. Thank you. Thanks, Paul.
Sorry, Kate. We definitely echo that comment about the teachers. In many ways, they are in the front line as much as anyone else, and they've been front and centre of this for many, many months. So I'm going to come back to probably Tom Beattie and Lucy on the first question, although I do feel we sort of answered it earlier. But Lucy, did you want to go first, or should I let Tom go first? Tom, would you like to comment on the Corby position again, as you did earlier?
Well, I mean, I think my point earlier was about the certainly the industrial nature of Corby and the sort of work that people do in Corby, which means that the ability to stay home and work from home is limited in ways that perhaps isn't elsewhere. I mean, I'm not saying that is completely unique to Corby, but I think that is one of the reasons. I mean, I think Lucy may have some other thoughts on what the other reasons there might be in Corby, and she's more of a public health expert on that and the sort of behaviours that maybe go on in our town and how that might contribute. But certainly that's what I would say. But I'd like to hear what Lucy's thoughts on that are. Yeah.
Lucy.
Thank you. I'll try and make it brief. But Corby very similarly has seen a pattern of increased cases as South Northampton have done in 10. And as I said, there's a very clear, I'm hoping that the maps will become public quite soon, when you see how the new variant is spreading up the country. It's following quite a clear pattern of county to county or borough and district transmission as we slowly go up the country. And obviously our case rates that you can see on the government website are reflecting that. I think one of the reasons that it's probably skirted around the edge and popped up more quickly in Corby, one is our geography. We know that the southeast, Milton Keynes, Peterborough and Cambridgeshire, etc., all the areas that sort of skirt the outside of Northamptonshire going right round up to Corby have had higher rates. So we will have seen a sort of a leaching where people travel backwards and forwards, have family in different areas, and that movement before Christmas, particularly while we were in tier 2, will have affected our case rates. In the more recent time over Christmas, Corby is a wonderful place to live. It has a really tight-knit community, and on the most part, that's a huge benefit, particularly when you're looking for support, when you're looking for people to be supporting each other and coming together. The challenge with that over Christmas was we probably saw a lot more mixing of households in Corby. You've got a lot of intergenerational families that live within that area who will have been visiting each other, I'm sure within the rules, but moving around the area, and potentially transmission will have been increased that way as well. But I think this is just sadly, obviously, a reflection of the current position and the fact that this new variant is so much more transmissible. You only need a couple of cases, and because you infect so many more people with this variant, it spreads like wildfire. And I think Corby, as South Northampton have been clear cases beforehand, is victim to that. One of the things I would mention though with regards to outbreaks is that we're seeing a much higher level of complexity with the outbreaks, as I said before. So not that many outbreaks as compared to other periods of time, but each outbreak certainly having a number more people involved in it. And Corby is not unique in that respect, but Councillor Beattie has written the letter for a reason. I fully support him in that we're seeing a lot more pupils in schools, we're seeing a lot more people in the workplace, particularly in places where we've got manufacturing, industrial services, which clearly cannot be done from home. They're working within the rules. All of those settings are working within the rules, but clearly every time you come near somebody else, you have the risk of transmitting if you have it and you're unaware, or contracting the virus. So the sheer numbers here are still, a challenge.
Thank you very much. Very, very well put there, Lucy. I'm going to move on. Sorry, Kate, but we're running short of time. In fact, we should have already finished, but we will carry on for a bit longer because we haven't met for a while. So we did expect to go a little bit longer, but I just want to try and keep roughly within our time frame. So I'm going to come now to Kevin Nichols. Kevin, hi, Kevin.
Hi, Ian. Thanks for coming, Sammy, and carrying on for a little while. Yeah, I'd just like to ask both the NHS and public health people. I saw some stories in the press last night regarding vaccination supplies running short in Birmingham. I've also seen comments on our Facebook page and social media sites about people again struggling to get test appointments. I just wonder, as the number of cases goes up, then obviously this is going to become an issue further down the line, perhaps. I just wonder, is there capacity in the system locally to cope with that?
I'm going to come very quickly to Toby, or Luke. It's a bit of both of you, really, isn't it? It's a question of supply. I think Toby may have already dealt with it, so I will come to Lucy. I'm very aware of time. We are running out of time because I know some people have to go to another meeting. So if you could keep it brief, Lucy, unlike me, who seems to have rambled on. Sorry about that.
So quickly from a testing perspective, I think Toby touched on vaccine earlier. Testing perspective, we have capacity at the moment. We have some areas that are more popular than others, but we obviously still have 3 local testing sites. We have our regional testing centre, and we've been given an additional mobile testing unit. So we're back up to 3 mobile testing units, which we're focusing on the areas with the highest prevalence at the moment. Some of those are working up to about an 80% capacity being taken. So, you know, a little bit of capacity left, but overall as a county, we still do have a reasonable amount of capacity. You just may be directed to a test centre that's not your nearest one. We're also going to be rolling out more of the lateral flow device testing, both to public sector workers. Obviously that's happening centrally in schools as well, but also we're working on a plan to get that out into the community. So we're building that capacity up over time. At the moment we have some, but you just may not find it's the nearest centre to you.
Thank you very much, Lucy, and thank you, Kevin. I'm sorry if that's been a bit brief, but we'll be able to give a lot more information about vaccination, I'm sure, over the coming weeks and testing. So thank you for your question, Kevin. I've got quickly, probably just enough time to cover 1 or 2 more. So I've got Alistair Ulk next. Alistair.
Good afternoon, can you hear me?
Yes, just about. How are you, sir?
Yeah, that's all right. I'll do that. Sorry, very briefly then. Sorry. One for Lucy or Toby. Out of those 25,000 that received the first dose of the vaccination, do you know how many have received their second?
I will go to Toby on that one. I suspect he's now the avowed expert. Toby, hello, Toby.
Hi, thank you. Alistair, thanks for the question. Entirely understandable question. Obviously, that we've moved over the last week nationally to a different position in terms of the second dose. So we are now consistently across the county working to the 12-week interval between first and second dose. A number of patients and also potentially some staff will have received a second dose already, where they was initiated very much at the early end when we started rolling this out back on the 9th of December. We will be releasing more data and numbers as we go forwards over the next couple of weeks, but that isn't information that I'm going to put into the public domain today. But we will share more details on that, Alistair, as we go forwards and as that starts to be released in line with national publication of data sets. Thank you.
I'm not sure I understand the reason why we can't release it.
I think he asked why we can't release it, because it's sensitive data and it's not allowed to be released. I think that's a simple answer, isn't it? Toby, did you want to?
Yeah, so I mean, people will have heard Boris Johnson, the Prime Minister, this week giving a commitment from next week to start publishing certain data sets in relation to vaccination rollout. And we'll obviously issue and release data locally in line with that once we start to reach that position. I was keen today to just put some of those key kind of headline numbers into the public domain, largely because I think it is so important for our local population to be able to see the good progress that is being made, because I really believe it's one of the few things that gives us all some hope, and hopefully will also give people some encouragement to continue sticking with the guidance and the requirements whilst we work our way through as rapidly as we can the rollout of that vaccination programme. But lots more on data to come for sure over the next couple of weeks. Councillor.
Just to come back on the sensitive data point, there is national data on how many people have had the second point on gov.uk. Is there a reason we can't release it locally?
Sorry, Toby. Alistair, we can take this offline if that's okay with you, I think, because we are running out of time. But I think Toby did explain quite carefully that it's national data that we're allowed to release when they allow us to release it. I think, is that not the simple answer? And we can, sorry, Alistair.
If you want to talk about it offline, when can we?
Yeah, we'll try and take something offline so that you can have a conversation with either Toby or Lucy about that offline. I'm so sorry to rush you. It's just we are getting very, very tight on time. So I'm going to come now to Carly O'Dell, and then I've got Stuart Ratcliffe for one very quick last question. So Carly.
Yeah, you can move on from me, and mine's been largely dealt with.
Thank you very much for that. Thank you, Carly, and thank you for your question. Stuart Ratcliffe, you've been waiting very patiently. You're the last, but by no means least, question.
Thank you very much. First of all, I just want to say thank you for all your honesty and all your help with this, with these calls. It is really enormously appreciated by us. But I just wanted to ask, just of Eileen, you mentioned the surge plans. Which could double capacity. What does that involve? Could you just put a bit more flesh on the bones on that you mentioned?
Thank you for that. Yes.
Hi, Stuart. So in terms of surge planning, and this was something that occurred also in COVID-1. So, for example, if we take Kettering as an example, ordinarily we might have 10 level 3 beds open and staffed in intensive care. We've already moved up to 15, but in terms of our surge planning, how and where would we put patients if we had to go up to 30 beds, for example? So that means that we have to work through where we would put those patients, what kit we would need to use, who would staff them, how would we supplement those staff, because of course from an intensive care perspective, we don't have 15 extra beds worth of nurses and doctors in our back pocket that ordinarily do that. So what we've been doing is looking at what skills and what personnel do we have that would be able to move into areas that should we need to step them up further, we could do that. And it's the same principle really for wards, for example. So we have wards that for planned care, we have emergency wards, we have medical wards, we have surgical wards, and it's really as the numbers of COVID grow, when they grow, if they grow further, it would mean taking more of that bed capacity, for example, and turning it into ward areas that would be able to nurse and look after medically patients with COVID, who also, by the way, might have lots of other things wrong with them as well. So we have winter plans every single year. So it's not new planning how to flex capacity, but I think the difference with this surge plan is it relies very heavily also on our partners and what we can do together in order to have people in the acute hospital setting that really, really need us. And for those that could perhaps be cared in a different way, in a different setting, how do we work together so that we can provide that? And that this year is to a level that we probably haven't done before. It's always tight at this time of year, but I think rather than, and we always plan for extra capacity, but on this occasion, knowing the spread and also what we might be facing in the next couple of weeks, and also learning the lessons from other parts of the country like London that we're already seeing, how do we maintain safety but look after people in the way that we can look after them. So that's sort of surge, and that's why we've had to move some capacity out for planned or routine non-urgent care, but we've either had to defer it and as the smaller numbers as we can get away with, or we've had to move to the independent sector to keep some of those cases going through. So it's really a bit of a jigsaw puzzle, but it's trying to make sure that we are planning for the worst should it happen, and anything back from that is a bonus. So that's how we do surge planning.
Thank you very much. Really appreciate that. Thank you.
Thank you very much, Eileen, for that very good explanation. And Stuart, thank you very much for that excellent question. I am very conscious of time, so I am going to actually close the meeting now, because there is another meeting due any minute now that some people have to attend. We are due to meet again next Friday. We may try and run a little bit longer if we need to next time, because I am aware that some of the questions were a little bit rushed, but I do hope that everyone's found that informative and useful. And thank you to our members of the press for their insightful questions. Thank you to our panel, of course, for their brilliant answers as always. And it just remains for me to say, have a good weekend. Stay safe, everybody. Let's follow all our guidance, and together